Before starting application, it is very important to make sure that the patient understands the procedure and has realistic expectations about the results. The area to be treated must be properly prepared. It is advisable to mark the trajectory of the injection. Once the patient is ready, the next step is to apply a nerve block to anesthetize the area to be treated. Even though the kit contains needles of different gauges, we advise the use of a 21G needle for injection until the physician masters his technique and feels comfortable using finer needles. When injecting, try to come in on a 90-degree angle to assure the proper depth of the injection. BEAUTYFILL is slowly injected into the deep dermis using the technique best mastered by the physician. The injected amount should be properly adjusted according to the depression being filled. We strongly recommend not to overfill. If this is your first time with BEAUTYFILL, try to be conservative about the amount to be injected. Once you gain experience and confidence, you can start using increasing amounts and experience with new indications. If the needle blocks, replace it immediately to avoid a sudden ejection of the product when forcing the suspension through the blockage. Injection techniques that can be used are canalization, serial puncture, and fan technique, as well as the cross-hatching and the inverted triangle techniques. You must thoroughly massage the injected area after application and advise the patient to do the same for 4 to 5 days. Tell your patients that they can expect tenderness and swelling after the procedure, but those are normal side effects of the injection that will resolve in 2 to 4 days. It is important to complete the patient's file with the product information after the procedure and follow up the treatment. It is highly recommended to take pictures of the treated area in order to objectively assess effects and results. Remember to place BEAUTYFILL safety labels on the patient's medical file and on his or her card to assure the implant's traceability.